Good afternoon, everybody, and welcome to today's virtual lunch meeting. My name is Alec. I'm the Managing Director for the Journal of Community Nursing and Wound Care People. And today's session, which is the Power of Debriding with Debrisoft and Debrisofting. And our speakers are Mags Morrison, who's a brand manager and regional clinical advisor with L&R, and James Ingle, who's an account manager with L&R. Mags, James, you there?
Hi. Yeah.
Excellent. Well, I'm really pleased that you're joining us, and I'd like to thank L&R for supporting this session. I know this is, I've certainly been very excited to watch this. For all of you who are watching from home, we do this all the time, but just a little bit of housekeeping. You'll see that we're presenting from our homes, so if there's any technical issues, do bear with us. As always, certificates for this session will be available via a link at the end, along with copies of any slides that you'd like to download. They'll be available via our website tomorrow. Again, we'll be putting links into there at the end of the presentation. Please do ask as many questions as you can. You can do that just by typing them into the chat box. And when I come back after the presentation for the live Q&A, we'll get through to as many of those as we possibly can. For now, I'm going to hand you over to Mags and James. I know they're really eager to get started. And so over to you, Mags. Mags, James, good luck. I will see you after the presentation for the live Q&A.
Thanks, Alec.
Thank you, Alec. Good afternoon, everyone. An overview of today's objectives will be that you will have an understanding of what wound debridement is, what mechanical debridement is, and review the Debrisoft range and be aware of our new clinical evidence. James and I are going to explore the theory of debridement, what it is, who can debride, why we debride, and what happens if we don't debride. We will review what mechanical debridement is and introduce you to our Debrisoft family and present a video of Debrisoft in action. We shall be sharing exciting new evidence that was published in the Journal of Wound Care in May, and it recognises the impact the introduction of using Debrisoft made with wound care prescription savings and overall reduction of patients requiring prescriptions. I'm going to hand you over to James now. Thanks, James.
Thanks, Max. So I'll start with what is debridement. Simply, debridement is defined as the the removal of foreign matter, dead or damaged tissue and debris. So who can debride? So how many of you out there believe that you can debride with your current skill set and the position that you hold? It might surprise you to know that any healthcare professional can debride. For example, applying a dressing such as a hydrogel to facilitate autolytic debridement of a wound. There are many other methods of debridement that require extra knowledge, skills and competencies, such as larval, ultrasonic, hydrosurgical, sharp and surgical. But the use of these will often be restricted by the availability of specialist staff and equipment. Another method that has become much easier to facilitate is mechanical debridement, with a monofilament fibre pad, for example, which requires very little training and therefore ideal for general use and even self-care, and can be far less costly than some other methods mentioned above.
So how many of you frequently debride as part of a wound care regime? And do you consider debridement as an essential part of wound care? Debridement should be an integral part of a patient's wound care treatment plan, and a comprehensive wound and patient assessment underpins the decision to debride a wound and which method of debridement to use. The role of debridement in wound bed preparation has been well documented, and effective debridement can improve wound healing across the wound healing continuum. Wound debridement also plays an important part in the process of wound healing, as the aim of wound debridement is to produce a healthy wound bed. So we want to remove the barriers to healing by reducing the bioburden and bacteria and disrupt any biofilm that is on the wound bed. So why debride? Because devitalised tissue is a physical barrier to healing. It may induce chronic inflammation. It can prevent the effectiveness of topical treatments, may cause an underestimation of the wound depth. It is a source of nutrients for bacteria. It can mask or mimic signs of infection, and it can contribute to a septic response. In this image, there's a wound prior to Debrisoft. I'm sure you've all seen wounds like this. Have a think about how long it would take you to debride this wound, and how long would it take you to achieve this. This is what could be achieved in 2 to 4 minutes using Debrisoft. Debridement can also assist in wound assessment by removing non-viable tissue, slough and excess exudate to help visualise the wound bed more accurately, which may then allow the clinician to significantly improve the patient's well-being and quality of life and contribute to optimal use of healthcare resources. But what can happen if we don't debride? The healing process is impeded, exudate volume may increase, the surrounding skin may become damaged, bacteria will proliferate, the wound may become malodorous, and wound infection may develop. But what does this mean to you as a healthcare professional if we don't debride? Well, the amount of visits and time spent on the wounds may increase. There may be an increase in dressing and product spend, not to mention the impact that this may be having on the patient's well-being.
So we've touched on what is debridement, why we debride, and some of the different methods that are available. One method that we're going to pay particular attention to for the remainder of this presentation is mechanical debridement. Mechanical debridement is the process of physically removing devitalized tissue from the wound bed or skin. Modern mechanical debridement is typically carried out using single-use products designed specifically to remove barriers to healing. The great thing about these solutions is that they offer quick and effective forms of debridement without the need for specialist training. Some may even open up the opportunity to self-manage wounds and skin, which has and will continue to be a major focus for the NHS to help save on time and resources. This is something that has been further highlighted over the past 14 months during the COVID pandemic, where many patients have been unable to attend clinics and potentially wanting to manage their wounds at home. There is also strong evidence to support the use of mechanical debridement to physically disrupt wound biofilm, which is strongly linked to chronic wounds and would otherwise lay dormant and non-responsive to topical antimicrobial dressings such as silvers. Mechanical debridement can be universally used for both acute and chronic wounds. So what do L&R have that can allow healthcare professionals such as yourselves or even patients to start effectively and safely debride wounds and skin? So let us introduce you to the Debrisoft family. So the Debrisoft family is uniquely positioned to be able to offer a mechanical debridement solution for almost all situations. It comprises of 3 products, a range which no one else can offer, and selection of each will be dependent on the wound or limb that you're treating. First off, we've got the Debrisoft Lolly, which, as you can see on the far left-hand side of the screen, sits on a flexible handle that allows you to debride areas with greater precision and reach. It's ideal for cavity wounds and those difficult to reach areas such as skin folds, between toes and diabetic foot ulcers. It's also great for those smaller wounds where you may not need anything larger. Next, we've got the 10 by 10 pad, which you can see in the middle, which is perfect for shallow wounds such as leg ulcers, dry skin, and features a handy mitt to be able to slide the hand in, which makes it a lot easier to hold and quicker to use than many other alternatives that are out there, especially when wearing gloves. The mitt also makes self-management a doddle for patients, with less chance of dropping the product and making application more efficient. Finally, we've got the 13 by 20, which is the largest of the Debrisoft family, and as such is great for larger wounds, legs, or hyperkeratosis. Again, it features the handy mitt to ensure ease of use even with gloves on. Due to the larger size of the 13 by 20, or the larger surface area, it's been shown to debride larger areas more quickly, further freeing up nursing time and resources. So how does Debrisoft work? Each Debrisoft product contains millions of unique, flexible monofilament fibers, cut to an angled tip and designed to reach uneven areas of the wound bed. As we move the Debrisoft over the affected area, the fibers safely loosen debris and devitalize tissue from the wound and skin without damaging any healthy granulation tissue. The patented fiber composites of the pad and lolly absorb and trap loosened debris and keratosis, as well as exudate and bacteria. The fibers within the product effectively lock away devitalized material and allow you to continually move over the area without fear of redepositing debris back onto the wound, unlike things like gauze, where you just use a single swipe. So how do we use Debrisoft? Simply, all we need to do is remove the product from the sterile packaging, moisten with saline or water, then simply use the soft side over the wound or skin in a gentle circular motion, or downwards motion when using on limbs where there is concern about hair follicles. We suggest doing this for about 2 to 4 minutes, or until the wound or skin is looking noticeably clear. Finished, simply dispose of the item and dress and cream the skin as normal. Where a patient has the capacity to be able to do so, Debrisoft is so safe and simple to use that a patient could even integrate Debrisofting into a self-care regime, empowering them to better manage their legs away from the treatment room or clinic. We're incredibly proud to say that Debrisoft is the most evidenced form of mechanical debridement on the market, with over 100 pieces of clinical evidence on a staggering 2,929 patients. Debrisoft is the only form of mechanical debridement that is recommended by the National Institute for Health and Care Excellence, otherwise known as NICE. The committee within NICE concluded that the technology is well tolerated by patients, it's likely to debride wounds more quickly, which can result in fewer nurse visits, and it's more cost effective than other debridement methods. So let's see Debrisoft in action.
So that was a short video of our Debrisoft family in action, and I hope it offered you the opportunity to see how safe, simple and easy it is to use Debrisoft on wounds. So this afternoon we would like to share with you some really exciting new evidence that demonstrates the power of Debrisoft and the impact that this could potentially have on your chronic wounds and your wound care prescription spend. The audit, which has recently been published in the Journal of Wound Care, identified a reduction in total and average monthly wound care costs in the 6 months following the introduction of Debrisoft compared with the 6 months before. The aim of the audit was to investigate the impact that Debrisoft could have on wound treatment costs and was an analysis of NHS wound care prescribing data in England. Prescription data was analysed for 486 patients who were prescribed wound care products in the 6 months leading up to the initiation of Debrisoft, which indicated that they had a chronic wound, received their wound care products by prescription, and would continue to need wound care prescriptions in the months after Debrisoft was commenced. By integrating the appropriate use of Debrisoft into wound care practice, significant potential savings on prescribing spend could be realised. As I previously mentioned, the aim of the audit was to show evidence of what the impact of introducing Debrisoft had on wound treatment costs. The costs were identified for the 6 months before Debrisoft was used and then compared for the 6 months after the introduction. In the 6 months prior to the introduction, there was an evident upward trend in prescribing costs. Following the initiation of Debrisoft, the overall cost of prescribing wound care items fell by 14%. Or in monetary value, the reduction equated to £101,723, as shown in the graph. There was also a reduction in patients receiving wound care prescriptions. This table highlights that the number of patients who received a wound care prescription in each month fell steadily post-introduction of Debrisoft, from 411 in the first month to 376 in the second month and 276 by the 6 months after the initial initiation of Debrisoft, which is a decrease of 43%, or 210 patients no longer requiring a wound care prescription. The audit has provided evidence regarding the impact of implementing Debrisoft on wound care prescribing costs and product use for the patients whose wounds were not healing after 6 months treatment without the Debrisoft. In the 6 months previous, the average monthly expenditure on wound dressings was increasing, and that was mainly because of a rise in antimicrobial and negative pressure dressing spend. I would like to share this table with you that highlights the prescribing savings that were made in the 6 months after the initiation of Debrisoft. There was a reduction of 16% for non-medicated dressings, 28% for negative pressure dressings, and 33% for antimicrobial dressings. These results suggest that the use of Debrisoft could reduce prescribing costs and the use of antimicrobial and negative pressure dressings. The cost of treatment for the patients in the dataset not only fell as a whole, but reversed the upward trend in costs that was evident in the 6 months before the intervention.
So, to summarise today's session, we've talked about debridement and how this is an integral part of wound management to not only reduce visible wound debris and chance of infection, but to prevent delays in healing and improve effectiveness of topical treatments. We've touched on some of the different types of debridement that are used and how some require specialist training and equipment, and subsequently often quite costly to initiate. However, mechanical debridement with Debrisoft can allow a wider skill mix to carry out effective and timely debridement of skin and wounds with very little training, as recognised by its NICE recommendation. Furthermore, it's so safe and simple to use that it can even open up the opportunity for debridement as part of a self-care regime, further freeing up nursing time and resources. So, hopefully, if I were to ask again, how many of you believe you can debride with your current skill set and the position that you hold, we may get a slightly different answer now. Finally, we delivered on our latest evidence to further demonstrate the power that Debrisoft can have upon prescribing data when used as part of a regular wound management strategy. an amazing 14% overall saving on prescribing costs, post introduction of Debrisoft, which equated to £101,723 over 486 patients. Furthermore, a 33% saving on antimicrobial spend was realised. And if we factor in that in England alone, prescribing costs for silver dressings currently tops £20 million per year, you can start to see the potential impact this could have. So to highlight, this was 486 patients. Just think what impact 2 to 4 minutes on each dressing change could have across your caseload, a whole trust, or the whole of the UK. So this is the end of the presentation. Thank you everyone for listening today. I'm going to hand you back now to Alec to introduce the Q&A session. So hopefully we can answer some of your questions. Thank you.
Thank you, James, and thank you, Mags. I know that you were really excited to do today's session. I think you did a brilliant job. So first and foremost, I'd like to thank you both for presenting today. So there's loads of questions that have come in, and I know we had a chat earlier on about some. But one thing that just struck me is you talked about, James, then just self-care, which is obviously something that we've done quite a few sessions with you on self-care actually, and some of our own, and so it's obviously a big topic. So how would you think about sort of introducing self-care then, or a self-care regime with Debrisoft? Is that possible? Could patients potentially self-care using Debrisoft? And if James, do you want to start with that, and then Mags, you can jump in perhaps?
Yeah, I'm sure we both got a little a bit to add to this, but certainly, I mean, Debrisoft is 100% will allow you to sort of initiate self-care with patients. So what I would generally say is, where the situation allows, I would always try and encourage patients to feel the Debrisoft pad, try it on their hand. If they have the capacity to be able to do so, to reach wherever that wound is, to try and use the Debrisoft over them, because I think it's one of those things where I always talk about anticipatory pain, similar to removing a plaster. It's always less daunting to do something to yourself than to have others do it to you. So, like I mentioned earlier, Debrisoft is so simple and safe to use that certainly if they have the capacity to be able to do so, I would try and encourage them to use it on themselves if possible. I don't know, Mags, if you've got anything to add from a clinical point of view.
Yeah, I totally reiterate what you said there. You've seen in the video how easy it is, how simple it is to use Debrisoft. Encouraging your patients to use Debrisoft in the skin or wound while you as a clinician is potentially preparing the wound dressings or the compression. It's a really simple way to introduce them to actually using Debrisoft on themselves, and also it's empowering for them as patients. So it could be a first step, even in that clinic, in that room with them at home, just asking them to give it a go, give it a try, and become more involved in the treatment in that respect.
Yeah, and do you have any then, this is just a question from me, do you have any resources then that you'd share with patients on how to use it? Because of course, one of the other questions we've got come in, which is quite interesting, is somebody has said that basically the Debrisoft is available in their area, but it's under specialist use. And so it says, what would you suggest in this situation? But before we get to that, it sort of links to that previous question, that if a product is under specialist use, you've got to think about how do you get it to be used by generalist nurses without going to a specialist, and then how do you get those people to teach patients themselves how to use it? I wonder whether you've got any advice or in fact any resources perhaps available that you'd like to share. Mags, do you want to take that? So there's two questions. Firstly, the specialist use bit, how do you get over that? And then secondly, do you have anything or any tips on how to teach a patient to use the product?
So if it isn't specialist use, then we've just presented a whole load of new evidence. There's such, it could be something that you could potentially take to, say, for example, your tissue viability nurse, showing them the evidence that we have here, seeing if there's any way that potentially that it may reduce like spend of their antimicrobials, etc. So it could be something that actually, once they look a bit more into it, they may be able to move like generalist nurses over to using that. With regards to the education side of it, it is such a simple product to use. It really doesn't take a lot of time and, you know, to actually do the education side on it. Really, it's just water on the product, and doing it for at least 2 to 4 minutes.
Brilliant. Anything you want to add to that, James?
Yeah, so from a, you know, I understand it can be quite tricky when you do have a product that's on specialist use, and you know, I think from my experience, it's about creating a rationale to take to whoever is in control of those specialist use products. So, you know, if you've got a wound that is non-healing, it's static, you're using antimicrobial dressings, for example, that there is almost a rationale to introduce something like mechanical debridement. So it's really about, you know, assessing that wound, working out what's going on, and trying to come up with a goal and objective for where you're trying to get to with that wound or that condition. You know, and if that wound isn't going where it needs and you need an intervention, Debrisoft can quite often be that intervention. So, you know, especially if you're dealing with biofilms and things like that, that's usually the key, is coming up for a rationale. So that would be my advice, really. And then secondly, to go on to how can we support patients in how to use Debrisoft or other products in terms of self-caring. We have got a fantastic resource that we've recently released called Squeeze In. It's a brilliant resource. It's all about supporting patients in how to self-care. We've got videos on how to use Debrisoft, amongst other things. So I would definitely sort of recommend having a look at that, and we can post the link to that afterwards. That's a great resource.
Brilliant. So we'll be posting links to, at the end of the presentation, we'll be posting links to resources that we've mentioned throughout the presentation, and also any contact details for Eleanor. So if anybody who's watching wants to contact directly with any specific questions you've got, all of that information will be available on the slides. Now, Mags and James, the first question that I've got here this is from Karina. And I think we've answered this, but I'm going to ask it anyway, because I think maybe just as a clarification, because we've talked about water quite a bit, but somebody is asking, or Karina is asking for you, James, is saline used along with Debrisoft?
Yes, you can use either saline or tap water. Quite often it's dependent on your local trust's recommendations. You know, sometimes they have different recommendations, whether that wound is acute or chronic, as to whether you might use saline or water. But the brilliant thing about Debrisoft is that's all you need to be able to activate that, and for it to be able to actually pick up and remove bacteria. So very, very simple and easy to use.
Okay, brilliant. Thank you for that. Let's have a look what else we've got. Cool. Mags, there's a question from you.
Alec.
Yeah,
I will just jump on in terms of we do advise like a fairly sort of specific amount to use with the saline or water. So try not to, when we're using the Debrisoft, moisten the pad. Try not to drench the pad in water or saline. We're just moistening it. Okay, just a little point that I would highlight there.
Yeah, and we can I know that certainly on things like your instructions for use on the packaging and things like that, we could actually stick links to that as a PDF next to the presentation for this, so it will have a bit more information specifically around sort of amounts to use and things like that. So yeah, we will do that. Mags, this is from Janelle. This is, how do you suggest we collect the devitalized tissue after debridement?
Well, it will be it will lift and bind into the pad, so it will actually be on the pad. Is that the question that's been asked? Sorry.
Yeah, I mean, I know there's some, personally, I know there's some comes into the pad. I'm wondering whether, if you think, whether Janelle is thinking about a sort of a wound that needs fairly heavy debriding, and whether it's going, you know, stuff is going to fall on the floor, perhaps. I don't know. Maybe we'll come back to that. And so just as always, as well, just to let you know, if we don't get through to any of your questions today, we do keep a list of them, and then over the next couple of days, Mags and James will respond to each of those, and we'll create a document which will which we'll host alongside the presentation on our website, so you'll be able to download it. So James, this is for you. How many times a week can you use Debrisoft, and for how long each time?
Great question, and one that we hear quite a lot. So it really depends on the situation that you've got. Again, what's the type of wound or skin condition that you're dealing with. If it's an acute wound, for example, a burn, gravel rash, things like that, just one application of the Debrisoft might clean that wound, and then that goes on to heal quite quickly. The more sort of chronic wounds that we're seeing, your leg ulcers, I would go back to, assessing that wound each and every time that you're changing that dressing. Is there devitalized tissue on the wound? Is there an element of colonization, bacteria that you need to address? Because if so, regular debridement will definitely be key. And, there's compounding evidence now that where there's a direct correlation between the frequency of debriding and the speed of chronic wounds to healing. So, I would say, as long until you get that to that really healthy granulation tissue, as long as there is debris, bacteria there, that it's going to benefit from debriding. So it really depends on the wound that you're seeing and the situation, and how long to do it each time. We recommend about 2 to 4 minutes, or until that wound is visibly clearer. It might need a little bit longer, or it might even clean up within about 30 seconds. But it's very much dependent on the wound and the type of debris that you're trying to remove. Okay,
and I read that question quite literally as well. So it said, how many times a week can you use Debrisoft? And it's a single-use product, right?
Mm-hmm. Oh yes, so sorry.
I read that, and you've answered it exactly, I think, how this person wanted it answered. But I read it thinking, are they asking how many times a week you can use a single Debrisoft? It's once, isn't it? That's
yeah.
So there you go. That may just be me being a little thick. So I do apologise.
No, you thought outside the box there. Definitely single use and dispose of after.
Can I? So we've got a question for you, Mags, here. And it says that in the presentation, it mentions appropriate use of Debrisoft. What would be classed as appropriate or inappropriate use?
So what I would say to you is, if you've got a wound that has got devitalized tissue, slough, just, really needing to clear up and see that wound bed, that's appropriate use. So inappropriate use would be where you were over wetting it, for example. Is that exactly what James said earlier on? I'm having a total brain freeze right now, guys, sorry. Using it as a tool in the shower, as a washing tool. It's not a washing tool, it's a debridement tool. So yeah, James, do you want to add anything in there?
Yeah, I guess so if you're dealing with something like very hard necrosis, for example, that might need softening first. So you might want to use something like we mentioned earlier, autolytic debridement. So you might want to use a hydrogel, for example, to soften that necrosis first, and then once it's softened, you could probably go over that with a Debrisoft. But there's very few sort of contraindications for Debrisoft, really. It can be used across sort of the whole spectrum of wounds and sort of skin conditions. But certainly on our literature, it will list all of the indications and contraindications. But
yeah,
where it's a chronic wound and there's a suspected biofilm, for example, that would definitely be appropriate use, because you want to basically get the biofilm moving off, and to allow the antimicrobials to actually get into that wound bed. So in circumstances like that, definitely that's appropriate use. Also for things like hyperkeratosis. And this is where a patient could potentially be doing this at home themselves, with the hyperkeratosis, and looking after their own skincare regime. So yeah, sorry, I just kind of butted in there. Sorry, James.
No, I think that as full an answer we can give to these people, then the better, as far as I'm concerned. James, another question. So I'll come to you. This says, I'm worried about pain for the patient. Any top tips?
Okay, completely understand anyone's reservation when it comes to, causing pain or discomfort to a patient over a wound. But from my experience, probably one of the best things is, once you've actually experienced using Debrisoft, you'll become a lot more sort of confident with it. But say if the patient is getting nervous about it, I always try and recommend getting them to actually feel the Debrisoft. It's so soft and fleecy. It's very hard once you've actually felt the Debrisoft to imagine it causing any discomfort. Secondly, I touched upon this earlier, if you can get a patient to use it on themselves to remove that anticipatory pain, and quite often they'll do a very, very good job on going over their wound or skin. Short of that, I mean, we've got a lot of evidence to suggest, our NICE recommendation suggests that, it causes minimal discomfort to patients. And what I would say is that, the faster we can move that wound on, if we can move it out that inflammatory phase of healing, the faster you're going to remove the pain that is involved in that wound. You're going to actually, if you remove that devitalized tissue, remove that bacterial load, you're actually going to help then remove or lessen the pain that's involved in that wound. So, the knock-on effects are quite significant. And I hope that answers it in a way.
Yeah, no, it does actually. But there's another question that has just come in. That came in from Yeti, and it's related to what you've just been talking about. And this was saying that that regarding the wound and its area may be very sensitive. So would painkillers be given prior to the procedure?
You could potentially give painkillers.
Sorry, Max.
Sorry.
Yeah. Go on, Max. Yeah, what's your thoughts on that?
Absolutely. If that is an issue, there's absolutely no reason why the nurse couldn't request like some analgesia from the GP. But just on that as well, and it's just an experience that I personally have had. If the wound is large, it could be that using the larger pad on a wound that is, if they're using like a 10 by 10 pad, for example, on a wound that's quite large, swapping over to using the 13 by 20 could also potentially relieve some of that, because obviously if it's a larger wound, then when you've got the larger pad, you've got a larger surface area. So that's something else that they could definitely think about trying if that is an issue.
Okay, thank you very much. This is.
Do you mind if I just?
Yeah,
Alex, do you mind if I just jump in? Sorry, just one more thing. I just thought of it is that the way the Debrisoft works is that you actually, if you are really very, very nervous, only the lightest of pressure is really, really needed to actually get those tips to activate and actually start to loosen that debris and bacteria. So, you actually don't need to apply that much pressure. You can, on your first application, you can go very, very lightly and then, apply the amount of pressure that you need to and that is suitable. Given the pain threshold of that particular patient.
And I think we saw that on the video as well, didn't it? The video is quite impressive when you see how light the action is. So brilliant, thank you. Next question: should I only use Debrisoft on infected or wounds at risk of infection? Mags, do you want to take that, or both of you? We'll start with Mags.
Yeah, I'll start with you. So it should be definitely part of your wound bed preparation, especially when the wound is static. It's not moving through the wound healing trajectory, or if there's a suspected biofilm, definitely it should be used. I said in the video, like wound debridement plays such an important role in getting that wound to start healing. And many wounds will actually need frequent debridement, especially chronic wounds. So yeah, no, it can be used across the whole spectrum. James, do you have anything to add to that?
Yeah, just just really to reiterate what you said, really, a lot of the wounds that you're going to be seeing will not be infected, but there will be, some level of debris, slough, or bacterial colonization that does need addressing. And in general, what I would say is that the faster you can clean, or the faster you can achieve a nice clean wound, the faster that is going to heal. So, like I say, used across the whole spectrum of wounds, whether it's infected or not.
Thank you both. That neatly brings us on to our final question, which is from Vicky. So this is, so if you have a patient whose legs you are washing in a bowl of water, are you not supposed to soak the pad? I'll come to you, James, for that first.
So thank you for that question. Ideally, if we can, so if you're washing the leg in a bucket, that's great, because it means that you're going to get all of that old cream and emollient off the leg, which is brilliant. What we would say is, ideally, if you could remove that leg from the bucket, pat it down with some paper towel, then use your Debrisoft. So moisten your Debrisoft then with a small amount of water or saline, then go over the leg or the wound. The idea is that if we saturate the pad or lolly, whatever we use, whatever product within the Debrisoft family that we're using, it's not going to have that capacity to be able to pick up bacteria debris, because it's going to be full of water. So we just need enough water or saline just to moisten, to activate that pad or lolly. Hopefully that makes sense.
Anything you want to add to that, Mags, as this is the last question?
Yeah, definitely. Just reiterating the emollients, please do make sure that you do remove the emollients from the leg. Exactly what James was just saying, you don't want them to be clogging up the pad or anything. So just make sure that you do get all the emollients off.
Okay, brilliant. Maybe you need like a little Debrisoft spray that comes with it, with how many sprays you need to stick on the pads before you start using it. Have I just invented a new product for you? Is that
there's an idea? Absolutely.
Is it? Yeah, maybe that's the way to do it. We'll talk about this offline and we can figure out what the commission on that is. Thank you very much for joining us. I'm sure some of you are looking forward to going and getting your lunch. Or if you've been eating your lunch during this virtual lunch meeting, which is what we hope you've been doing, then we hope you've enjoyed it, both the session and the lunch, that is. Mags and James, thank you very much for a really interesting presentation. I personally love Debrisoft. I started in this industry in publishing and events when you launched it. And so seeing the evolution of it over the last few years has been really quite fascinating, not just in terms of different sizes, but in different applications and all the rest of it. I'd urge any of you that want to find out more about Debrisoft to contact Eleanor directly. Their email address and website information should be on the screen on the slide now. As of tomorrow, we'll have this presentation up on our website, along with the slides and some other documents that we've mentioned today that you'll be able to download, share with your colleagues, tell them how much of a fascinating time you've had and that they should watch this too. So please do that. Enjoy the rest of your day, everybody. Thank you very much to Eleanor for supporting another virtual lunch meeting, and we look forward to seeing you all very soon. Goodbye.